After running the course for a few years, we recognized that there was also a need to teach some of the ancillary healthcare providers, some nurses, physician's assistants. And so we started a nursing workshop as well. So the nursing course goes in parallel with the trauma course, but there are specially prepared nursing workshops with topics that are selected by nurses, but taught by the same expert faculty that are in a small breakout session. And these have been quite popular.
My name is Dorothy Christian. I'm an NP in orthopedics. I primarily work on the floor. I've been going to the trauma course for 10 years since it started. The primary way this course impacts my role is in patient education. Learning all the different surgical techniques and approaches helps me at the bedside to teach patients. The way this course is different is that it's specialty-based. This course is excellent for any kind of PA, NP, physical therapists working in and around orthotrauma patients. I think the quality of the nursing workshops, the surgical workshops, and the speakers are all fabulous. As nurses, we can switch from watching the actual surgical procedures that they're simulating. We can go to the nursing topics, which include anything from infection control to joint injections, and it just gives us a good overall view of the newest information. Every year there's little twists on the topics with excellent speakers all the way around. The workshops that are tailored to the nurses, it's informal, so it's a lot easier for people to talk, to chat, to laugh, and meet each other and just share stories. I think that the nurses who would benefit most are nurses who are actually working in orthopedics, nurses who are working in the OR, and it's just a great education all around for any kind of ortho nurse.